If you are a person in crisis, or somebody thinks you're a person in crisis, police officers might be asked to check on you. This is the mental health law that applies to these situations. Police can talk with you and decide everything is okay, then leave. Officers can offer to connect you with a community-based service or take you to the hospital if you want to go. You can ask to be connected to the services you want, and they can try if it is possible. Officers can also call their Mobile Crisis Intervention Team, or MCIT, to talk with you further, which is made up of one police officer and one hospital-based nurse. But what happens if an officer decides that everything is not okay? Watch this.
If someone I know or my doctor wants me to go in for treatment and I don't want to, can an officer force me to go?
An officer cannot force you to go to a psychiatric hospital or facility without a form from a doctor or justice of the peace, unless they think that you are acting in a disorderly manner and that you have a mental disorder, and that you will or have threatened or attempted serious bodily harm to yourself or somebody else, or you are behaving violently towards another person, or have caused another person to fear bodily harm from you, or they believe that you don't have the ability to care for yourself to the degree that you could become seriously impaired, and that would be dangerous to wait for someone to get an order from a justice of the peace. An officer can take you to a hospital to get assessed if a doctor or a justice of the peace has sent them a form stating that they must do so. But the following conditions have to be met. The doctor would have had to have seen you in the last 7 days. Someone would have had to go before the justice of the peace to swear it was necessary. As well, the doctor or JP can use the same standard as the police, or they could also use this additional reason. If they believe you have a mental disorder that responded well to treatment in the past, and that you will get worse, and that you do not have the ability to judge whether you need treatment, and you have a substitute decision maker who has consented to you getting treatment. If you feel you have been mistreated, you can file a complaint with the Office of the Independent Police Review Director, or directly to a Toronto Police Service supervisor.
If you're in downtown Toronto and in crisis, you can contact the Gerstein Center 24-hour crisis line at 416-929-5200. To contact the Substance Use Crisis Team, call 416-962-0220 from 10 a.m. to 6 p.m. If you are kept in the psychiatric hospital against your will for more than 72 hours, or if you have been found incapable to consent to treatment or to manage your property, a rights advisor will contact you to tell you your rights. They will tell you how to appeal if you want to do so and can help you get a lawyer.